Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Welcome to rePROs Fight Back. Today's episode should be a fun one. Being in Washington, D.C., I'm lucky that I get to take advantage of a lot of amazing organizations that bring in advocates from around the world to talk about sexual reproductive health and rights, issues either on the Hill or for special events. Today, I am extra lucky because the Center for Health and Gender Equity, or CHANGE, brought in several advocates from Africa, and I am so lucky to get to talk to three of them today. First, we have Thandie Msukuma from Malawi. Hi, Thandie. Thank you for being here.
Hi. Thank you for having me.
Next, we have Dr. Lilian Benjamin Mwakyosi from Tanzania.
Very pleased to be here.
And then, last but absolutely not least, we have Hilda Zenda from Zimbabwe.
Hi, everyone. Hilda Zenda here.
So since we are lucky to have three different people, so that's three new voices for our listeners to get used to, why don't each of you take a minute and introduce yourselves? Tell us a little bit about yourselves and your work, and that way listeners can not only learn about you, but they can learn who's talking when.
Hailing from the beautiful land of the United Republic of Tanzania, my beautiful name is Lilian Benjamin Mwakyosi. I am a medical doctor, a very proud young woman, and a community advocate. I'm an AVAC Fellow 2018, hosted by Tanzania Youth Alliance. I've been doing a lot of advocacy around combination HIV prevention for adolescent girls and young women, specifically focusing on access to pre-exposure prophylaxis and HIV self-tests for this age group, 15 to 24.
Hello, my name is Thandie Msukuma. I'm from Malawi. I work with a TB organization that works in the communities. I'm actually a human scientist. Apart from that, I'm also an advocate. I advocate for young girls and adolescent women concerning issues concerning reproductive health, HIV and AIDS, all those cross-cutting issues, really. So I think my recent advocacy work was coming up with community guideline on what we actually want in the Contribution Plan 2019, the one that PEPFAR comes up with.
Hi, everyone. I'm Hilda Zenda, and I'm from Zimbabwe. I work for an organization that's known as Pangea Zimbabwe AIDS Trust, and one of our key programs is working with key populations, of which adolescent girls and young women are part of, just creating safe spaces that are youth-friendly to our young women to be able to access HIV prevention, treatment and care services. This includes HIV testing, this includes the rollout of PrEP, as well as just providing life skills to young women and girls in the community.
So one of the things that I think you all seem to be very much experts in is the importance of comprehensive sexual and reproductive health services, particularly when it comes to HIV prevention. So you want to talk a little bit about the importance of that and what's going on in your country?
I think one of the importance of comprehensive HIV prevention methods, I think that we've seen from the experiences that we've seen in our countries, is that when it comes to HIV prevention, it's not, there isn't only one solution or one way in which you can do things. We've seen that it works better when it's coming as a package, because then the package will be able to address the different barriers that hinder access to sexual and reproductive health services, as well as HIV prevention methods. So the idea of a comprehensive approach allows for all those barriers to be addressed. And at the end of the day, it allows for our goal, which is accessing, helping our young women to be able to access the primary service, to be able to actually access it.
For sure. Lilian, you talked about that you worked around youth. Do you want to maybe talk about the importance of youth in that?
So it's necessary to include youth. For instance, the situation is similar to Zimbabwe in Tanzania. And for me, as a young person myself, I look at this package I mean, it's not just about the package, but what's included in the package. And one thing I've noticed that is missing at the moment, we have interventions, yes, but then still the rate of new HIV infections among young people is still very high. And that kind of communicates that maybe the current interventions do not fully speak to our needs. So I look at this as the ability to have more options, expanding options and choices young people can look into for prevention.
I actually agree with Tanzania and Zimbabwe because we really can talk about comprehensive sexual reproductive health rights without cutting into the HIV prevention issues. So currently in Malawi, we have very limited HIV prevention methods. We have the condoms, which I think, some people might actually be allergic to latex. And we have the PMTCT, which is prevention mother-to-child transmission, which I feel like it's a little too late for that because you have a mother who's already pregnant and then she already has HIV, and then you're just trying to prevent the child, but we have to an extent failed the mother, And then we have things like voluntary male circumcision. And currently we have a PrEP policy, but we still haven't had that roll out. And we have a lot of young girls and adolescent girls and young women in the communities that are actually ready to start using PrEP, and they really want to have it up and running, but then for some odd reason, it's dragging, and then it's kind of like minimizing the momentum or something like that.
And maybe to add on, I think it really matters how young people are engaged and involved throughout the processes towards having all these services. Perhaps the reason to why the uptake of services by young people is not as good, it's not as good because maybe we were not involved in the planning processes, and we have products that are introduced, HIV prevention products. Was there any concerns of young people prior to producing such products? We want to be consulted from the very beginning, not bringing up the product and then that's when you start asking, do you feel like you're going to use this, or is this product going to help you also?
But also the messaging around these products. For example, you have contraceptives, yes, which are viewed as family planning method.
Right.
And then you have the youth that think, okay, fine, contraceptives are for people in marriages and, married women with, let's say, 5 kids. But you could be 19 and you could still be using contraceptives because, that's good sexual health. So it's all these issues that just,
Yeah, and I think it's one of those things, particularly with the family planning, like we are so used to saying that. And you're right, like young people, that is not what they're thinking about. They're thinking about not getting pregnant. They're not necessarily thinking about planning their family. So making sure that we're using a language that's accessible to young people and the language that they would use themselves to make sure that the services are friendly, but that you're bringing them in to access the services to begin with.
I totally agree with you.
I think another thing that's very important is having our young women actually leading these programs, because in many of the cases we do not have young women who are leading these programs. And I mean, if it's for young women, then it should be led by young women.
Nothing for us without us.
Yeah, exactly. Well, and I think another thing you often hear, and I'm sure you have seen this in your countries as well, is there's the talk of wanting to make sure that there's more access to services for young people, but they're not, when they go to see the provider, maybe the provider is not, maybe shames them, or they don't feel welcome to go see them to talk about their full needs. And so the problem of, once you bring them in, they need to also be in an environment that is friendly to youth.
I agree. And I think it all comes from the roots that we were raised from. We come from very sort of conservative societies, and we are progressing somehow, but then you can't just change everybody all at once. It takes time, I'm thinking. So remember, if you go to school, the person who is teaching you, giving you the knowledge is an adult, But at the same time, they are parents who can talk, for instance, to their kids back home about certain things, sexual issues, I would say. The same applies to healthcare providers. If my mom, for instance, can talk to me openly about certain things, I like to believe they'll wear the same sort of, bias when they're attending to a younger person in the clinic as well.
Mm-hmm. Yeah. And I think we're seeing more and more of that amongst young women where, I think even just among us if you think of your first sexual encounter, it's not that it was something that you had been told about or you knew exactly what to expect, but it's information that you hear from outside of the walls of what you would call home. And I think that's one of the key barriers that we're having, I think, within our societies is that we do not, within our homes where our young women are growing up, they don't have that safe space and they're not learning these things from home. They learn everything else from home, going to school, focusing on school, doing well. But the one key thing that that's not being instilled in them is about how life is like out there, and with regards particularly to their sexuality. So I think that's also one of the barriers that we're having within our societies, that our young women, we get to learn about all these things outside of our homes, and yet everything else we're learning from home.
What about access to comprehensive sex education in your countries? I can start. I grew up in rural Wisconsin, and I went to a Catholic school, so my version of sex education was if you've seen the movie Mean Girls, you're going to have sex and you're going to die. It was not by any means comprehensive and helpful later in life.
I think it's the same because we have what we call life skills.
Yes.
And
so I had valuing your sexuality.
So, all these little this and that, but never really the big things. They never really dig deep into the sexuality component. So you have older men and older women teaching you about, okay, so this is what happens. People have sex. Kids just don't pop up. People have sex, but usually married people have sex. And you can't really have sex outside marriage because it's a taboo. So, you're all going to burn and die if you have sex now. But
that sounds familiar.
Exactly. So it doesn't really give you opportunities to ask more questions or talk about what you're going through, because it's more like, I might die, or they might tell my mom, because these are very small communities and everybody knows everybody and people are just talking, so you don't seem like that kid, so you're that taboo kid, huh? So usually it's never really that comprehensive.
The situation is similar in Tanzania. We do have an element of comprehensive sexual education in schools, certain levels of school actually. And like Thandie mentioned, that you're given the knowledge in brackets. Like, you are not told everything and you can't really ask everything because of the age gap that it is there. But then at the same time, you can't really ask certain questions because of the shaming around sexual education from your colleagues in class as well. And remember, this same teacher is a parent back home again. So if my parents back home cannot give me certain informations because they are expecting my teacher to do that, it is the role of my teacher. But then he is a parent, or she is a parent as well. So there's that way of wearing that character and just go all parents on us. Everywhere.
Yeah.
Yeah, I think it's very similar in Zimbabwe too. We do have a program that's being run in tertiary institutions. But I think, like Lilian said from Tanzania, one of the challenges we have is the people who are presenting this information and knowledge to our young women. They are not necessarily youth-friendly people, and they are much older. So if a young person is actually listening to this much older person, it's more like you're listening to your mom and dad. And already, if it's so difficult having your mom and dad, communicate about such issues, the chances of you then listening and it's your lecturer who's giving you this information is very slim. which creates the barrier. And I think it also doesn't open up for our young women to be able to engage and ask questions that they may specifically have regarding their sexual health.
And considering we're in this digital era, do parents really want us to learn everything from the internet? This is a good question to everyone.
Yeah, absolutely.
Yes.
I mean, you guys are going to get young people are going to get the information somewhere.
Yes.
Wrong information sometimes.
Yeah, most of the time.
So you talked about the importance of having youth involved in services. Do you see some of the peer-to-peer education happening in an organized manner around sex education and services as well?
It's been a thing of late using peers to reach out to peers. But then I don't think it's something that is nationwide yet. And yeah, I think we're getting there.
I think it's similar with Tanzania in Malawi. We have some programs. We have some programs that utilize peer-to-peer mentorship, or we have what they call the girl guides. So they go around and convey messages on sexual reproductive health, HIV, all those things. But then we don't really have much of it. It's there, but like at a very minimal scale of some sort.
Yeah, similar to Zimbabwe, we have what we call CATS. And basically, yes, it's also young women who engage with other young women on these particular issues. But I think what's also interesting, just touching on what my fellow countrywoman Lilian has mentioned from Tanzania, is just the aspect of trying to see how we can not completely do away with our culture as a country, because when we look back, look back, like in our culture in Zimbabwe, I mean the specific people who used to tell us about this information would be our aunts. And I think in terms of programming, I think we shouldn't necessarily do away completely with that channel of messaging, but maybe try to see how we can start incorporating the cultural aspect and training, maybe coming up with a program where we're actually calling upon, we call them vanatete, and getting them, actually training them on how to communicate this information and what's really changed. Because I mean, to them, I'm sure the information they got about sex is different from what it is like today. So I think maybe coming up with programs that can incorporate the cultural aspect of our country, because I guess if we do that, then it allows for a lot of people to be a bit more accepting of the idea of what sex means in our days, and as well as the idea of just having someone talk to our young women and girls about sex.
Actually, my friend here just reminded me of what we have in Malawi. It's what we call the mother groups. So these are women that talk to young mothers, because I think before we had the law of bringing girls back to school, you actually used to get expelled and, you'd be shunned from school when you get pregnant. But after the bring girls back to school campaign and everything, we actually have mother groups who go to young mothers, they mentor them, talk to them, and actually in other instances, they actually look after their babies whilst these women go back to school. So I think we could have that same approach, but with sex education, where we have older women talking to girls about just comprehensive sexual education.
I'm actually learning something from my colleagues right now. So currently in Tanzania, once a secondary school girl gets pregnant, they are expelled from school and they cannot join public schools ever again. So I don't know, maybe that model and the movement of bringing girls back to school would really work in my setting as well.
So I know one of the things you were in D.C. for was to talk about how U.S. policy is affecting the lives of women in your country. Do you want to talk a little bit about that right now?
As a Malawian, I would like to say the Malawian youth are actually very grateful with the funding we receive from the American people. We have the PEP for funding, mm-hmm. And then within the PEP for funding, we have what we call the DREAMS program, which is Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe. DREAMS program, where it's like a comprehensive package that is given to young girls, young adolescent girls and young women. Yes. So it's about economic empowerment, sexual reproductive health services. It has all these. They understand that if you want to empower a girl, there are a lot of cross-cutting issues that surround her. So for you to be able to empower her and give her the right materials and everything, you have to like get into a little this and that, some education, maybe some business, some health information and all that. But currently we only have that in like 2 districts, and I think they're adding a third one. But Malawi has like 28 districts. Those are like, so even half of what we actually have. And I think it would really be helpful. And I think a lot of women would really like to utilize this program because it's really working.
Oh, that's good.
Yes, for this districts, it's really helping. You have a lot of women retained on ART, and you have all these good things coming out of it. And I think the other adolescent girls and young women across Malawi would really utilize this service.
The situation is similar in Tanzania, but a little bit of a different context. So most of our HIV prevention care and treatment programs are run by the support of PEPFAR, and the country has been making really incredible strides to end the epidemic. We see the progress and we appreciate it. And the most recent excitement for me was introduction of PrEP in Tanzania, pre-exposure prophylaxis. This is a pill that once taken daily can prevent a person from contracting HIV. It reduces the risk of getting HIV infection. And currently, we are not there yet, but we do have this demonstration study, more of like an implementation science, that is targeting key and vulnerable populations. And I'm very glad to say young women are reached out. Adolescent girls and young women are inclusive in the KVP group. Okay, we are getting there, but then there's still some challenges around the use of this oral pill. Adherence remains an issue, and we still have like high rates of dropout from like the rollout of using PrEP. This speaks loud to me. It sends a message to me that perhaps we need more options. And this time around, if the pill is not as it doesn't cover the demands of young people, maybe we should look into investing more in the injectables or microbicides, things that people can use without maybe swallowing them, but then use them topically. And they should be more of user-controlled. So we need variety of options to cater for the needs of young women and young people and the whole population generally for HIV infection and end the epidemic.
Options are always better, so you can find what works best for you and the one you can adhere to.
You can always try different options to know what works best for you. Yeah. One size clearly doesn't fit all. Yeah.
So, do you guys have a message that you would like to send to the U.S. government on behalf of the youth of your country?
Absolutely. I think first and foremost, we'd just like to thank the U.S. government for their continuous efforts towards trying to end this epidemic in our countries. I would also just like to give thanks to Change for giving us this opportunity, as well as yourself, rePROs. Thank you for that. But I think my message would be that we just want to let everybody know that we really do appreciate the funds that we're getting, and we are utilizing them as best we can, specifically looking at HIV prevention programs for adolescent girls and young women. Looking at the DREAMS program, we have seen that it works, and it's working very well for us. Our only cry is that it continues, and we're able to then get to a point where our countries are reaching a sustainable point where they're actually able to run these programs on their own, with or without U.S. funding.
Okay, well, for me, as a young woman, and I believe everyone out there is somehow, somewhere affected by the epidemic HIV. So I'm coming from a setting where young women remain highly vulnerable to new HIV infections, and the rates are actually very high as compared to most other populations and age group. 15 to 24 are the most highly affected. This could happen to anyone. It could be me, it could be someone else out there, it could be a sister or anybody else. And this is why I'm deeply, really concerned with the issue of expanding options. So my call to the U.S. government is to look into expanding HIV prevention options and all sorts of options, both systemic and non-systemic and user-controlled. And that way, I look into options in the aspect of expanding research, information, and access to information for young women, expanding interventions themselves, and last but most importantly, the uptake of these services by young women. So they should be easy and accessible way to get to these services to end the epidemic.
So we've talked a lot about girls and women, which obviously we're super important. But I think one thing we haven't really talked about is boys and young men. Do you guys have projects or just want to talk a little bit about the importance of making sure that we're integrating boys and men into these programs as well?
I think we currently have a limited number of programs that are specifically for boys and men in our countries. And I think one of our cries right now is, as much as Dreams is working, we would love to see the incorporation of programs similar to what Dreams is like, but specifically focused on young boys and men. What we understand is that if we're empowering this young woman and she still has to go out into society, and the same person that she's going to be dating is a young man or a boy, and if this young man or boy is disempowered, it makes it very difficult for this young woman to be able to practice her empowerment or to be able to have control of her empowerment. And I think if we're really if we're really going to be investing in lives and investing in these programs for adolescent girls and young women and empowering them, we need to be looking at a sustainable way of doing that. And the only sustainable way we can do that is by ensuring that the environment around them is also growing with them. And that will need for young boys and men to be included in these programs and also be empowered.
I think on the same note, it would also be important to incorporate our religious leaders and our community leaders, because these are what we consider our gatekeepers, When the girls are empowered, wherever they are, they have to go back to their communities, and then they find their leaders there, their religious leaders there. So you're empowered, you go to church, but there's all this, and then you sort of kind of feel like your people are letting you down, in a sense. So I think if we reached out to the leaders and the community leaders, the religious leaders, and just empowered them also for them to be able to actually prepare their congregations on, this upcoming empowered girls that we're modeling, I think would really be important for sustainability of these many projects that we're actually embarking on.
And I highly second everything my colleagues have said. One important factor that I would add in would be I look at this current generation as the game changer. We are the ones that are going to change so many things. And when we're thinking of how to involve boys and men into these movements to end the epidemic, it's really necessary to think about the next generation of young boys and girls.
Well, great. I think this was a great conversation. It was great to learn more about the work that's being done in your countries and the work that still needs to be done. So big thank you, Thandie and Hilda and Asante Lilian.
Karibu.
Great. Thanks for being here.
Thanks for having us.
For more information, including show notes from this episode and previous episodes, please visit our website at reprosfightback.com. You can also find us on Facebook and Twitter at reprosfightback. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.